Depressed individuals may particularly benefit from the repeated practice in generating positive mental images that is encouraged by Imagery-CBM. Furthermore, mental imagery has been relatively neglected in depression and thus may provide a new and promising avenue for treatment development. This is from the article Positive Imagery-Based Cognitive Bias Modification, that's the CBM, as a web-based treatment tool for depressed adults, a randomized controlled trial by Simon Blackwell, Michael Browning, there's a few others, Andrew Matthews, Emily Holmes, Anard Piquet, and there's a few other authors of this particular article. My name is Alexandria. I am an imagination and manifestation expert. As a visual and performing artist, I use my imagination for creativity and to manifest the things I desire. If you are someone who is interested in manifesting the things that you desire by using your imagination, I have a couple of guidebooks for you. The links for those books are in the description. Here is the abstract for this article. Depression is a global health problem requiring treatment innovation. Targeting neglected cognitive aspects may provide a useful route. We tested a cognitive training paradigm using positive mental imagery, imagery cognitive bias modification, Imagery-CBM, developed via experimental psychopathology studies in a randomized controlled trial. Training was delivered via the internet to 150 individuals with current major depression. Unexpectedly, there was no significant advantage for Imagery-CBM compared with a closely matched control for depression symptoms as a whole in the full sample. In exploratory analyses compared with the control, Imagery-CBM significantly improved anhedonia over the intervention and improved depression symptoms as a whole for those participants with fewer than 5 episodes of depression and those who engaged to a threshold level of imagery. Results suggest avenues for improving Imagery-CBM to inform low-intensity treatment tools for depression. Anhedonia may be a useful treatment target for future work. The link for this article is in the description. If you like this content, please share it with others. Also, hit the like button. If you're interested in listening to more of this type of content, please subscribe. My goal is to keep this going daily with reading different articles, coming back to some and going in a little bit deeper on these articles, because this is a really good time to tap into the imagination and to really bring about the future we desire to have. And it's going to take work. My goal is to read these articles to help the logical side of the brain, feed the logical side of the brain, let the logical side of the brain know that it's okay, that the imagination takes place and what that logical side of the brain needs in order to be silenced for the imagination to take shape and take form. Stay wealthy.